Hello friends, welcome to Medical Marrow. I am Dr. Shivam Singh here. In this video, you are going to know about the testing and diagnosis of COVID-19, preventive measures and treatment available. But before starting the topic, I would request you to please subscribe my channel if you have not subscribed yet and press the bell icon so that you would be updated about the channel activities. We'll start with test for COVID-19 and their types. There are two types of test for COVID-19. Test for antibodies and test directly for the virus, that is RT-PCR test and NAT test. Antibody testing for COVID-19. It's possible to catch SARS-CoV-2, the new virus, and not know it. That's because not everyone infected with the virus has symptoms, but there is a fast blood test that may tell you if you have ever been infected. It's called an antibody test. Experts hope it can give health officials a better idea of how widespread this new coronavirus is. What is antibody test? You may hear it called a serology test. It looks for certain thing called antibodies in your blood. Your body makes this when it fights an infection like COVID-19. The same thing happens when you get a vaccine, a flu shot. That's how you develop a immunity to a virus. The antibody test isn't checking for the virus itself. Instead, it looks to see whether your immune system, your body defense against illness, has responded to the infection. How does it work? You will have to give some blood, like through a finger prick. Doctor test for two kind of antibodies of SARS-CoV-2. They look for IgM antibodies, which develop early in an infection, and IgG antibodies, which are more likely to show up later after you have recovered. Though antibody test cost approximately Rs 500 and give result in 20 to 30 minutes, but testing for antibody can be misleading in the first week of infection. From the day of contacting the virus to day 7, an individual will start showing the symptom of COVID-19 and may start infecting other as well as, but even after repetitive test, there is possibility antibody test will give a false negative. The reason behind antibody takes 8 days to develop and actually appear. This means antibody test will give accurate result from the 8th day of being infected. What is RT-PCR and NAT test? For testing the virus, there are two kind of tests available. NAT, nucleic acid test, and RT-PCR, reverse transcription polymerase chain reaction test. Both the tests require a nasal and throat swab. While NAT costs Rs 2800 without duty and takes about an hour, RT-PCR costs Rs 4500 and require 5 to 6 hours to test the sample thoroughly. Both NAT and RT-PCR test look out for virus, hence they give positive result from day 1. Though NAT test has been approved by FDA, currently in India, RT-PCR is being followed for diagnosis of COVID-19. Now we will talk about the preventive measures. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precaution. Regularly and thoroughly clean your hand with an alcohol-based hand rub or wash them with soap and water, because washing your hand with soap and water or using alcohol-based hand rub kills virus that may be on your hand. Maintain at least 1 meter, that is 3 feet distance between yourself and others, because when someone coughs, sneezes or speaks, they will spray small liquid droplet from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplet, including the COVID-19 virus, if the person has the disease. Avoid going to crowded places, because where people come together in crowd, you are more likely to come in close contact with someone that has COVID-19, and it is more difficult to maintain physical distance of 1 meter. Avoid touching eyes, nose and mouth, because hand touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose and mouth. From there, the virus can enter your body and infect you. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately and wash your hand, because droplets spread virus. By following good respiratory hygiene, you protect the people around you from the virus such as cold, flu and COVID-19. Stay home and self-isolate even with minor symptoms such as cough, headache, mild fever until you recover. Have someone bring you supplies. If you need to leave your home, wear a mask to avoid infecting others, because avoiding contact with others will protect them from possible COVID-19 and other viruses. If you have a fever, cough and difficulty breathing, seek medical attention, but call by telephone in advance if possible, and follow the direction of your local health authority, because national and local authority will have the most up-to-date information of the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of virus and other infection. Now we will talk on treatment of COVID-19 and drugs available. With confirmed COVID-19 cases worldwide surpassing 4.3 million and continuing to grow, scientists are pushing forward with efforts to develop vaccine and treatment to slow the pandemic and lessen the disease damage. Some of the earliest treatment will likely be the drugs that are already approved for other conditions or have been tested on viruses, because vaccines are still under trial. Let's see antivirals. Remdesivir. Developed a decade ago, this drug failed in clinical trial against Ebola in 2014, but it was found to be generally safe in people. Research with MERS showed that the drug blocked the virus from replicating. The drug is being tested in many COVID-19 clinical trials around the world. Caletra. This is a combination of two drugs, lopinavir and ritonavir, that works against HIV. Clinical trials are being done to see whether it also works against SARS-CoV-2. One small study published May 4 in the journal Medicine by Cell Press found that lopinavir-ritonavir did not improve outcome in people with mild or moderate COVID-19 compared to receiving standard care. Favipiravir. This drug is approved in some countries outside the United States to treat influenza. Some report from China suggest it may work as a treatment for COVID-19. This result, though, haven't been published yet. Now let's see about anti-malarial drug Hydroxychloroquine and Chloroquine. This drug received emergency use authorization from the FDA at the end of March. Clinical results, though, have been mixed. In early May, the author of an observational study in New England Journal of Medicine reported that patients who have been given hydroxychloroquine didn't benefit. The medication didn't harm the participant who took it, but the drug also didn't lessen their need for ventilator or reduce their risk of death. Another study found that hydroxychloroquine with or without the antibiotic azithromycin didn't help people with COVID-19. Monoclonal antibodies. These are ready-made antibodies. These drugs trigger the immune system to attack the virus. Blood plasma transfer, or also known as plasma therapy. Along the same line, the FDA has announced Trusted Source, a process of medical facility to conduct trial on an experimental treatment that uses blood plasma from people who have recovered from COVID-19. The theory is that the plasma contains antibody that will attack this particular coronavirus. In late March, the New York Blood Center began collecting plasma from people who have recovered from COVID-19. You can see in this chart that there are 23 treatments under study, as well as under use for pre-exposure prophylaxis or post-exposure treatment. Last but not the least, I would like to say that prevention is better than cure. Be smart and alert. Follow the guidelines as advised by your governing body. Thanks for watching. If you like the video, please hit thumbs up, and if you want to see more videos, hit the subscribe button too. If you have any suggestion, question or anything to say, please leave a comment below.